I repeat, the biggest mistake that most of the OET participants, candidates commit, and even the training institutes also commit, is that they are just doing this method. Where are the questions? Where are the options? And where are the answers? Actually, this method is not going to help you. This is going to help you very, very, very little. It's like you're giving a small injection to a patient who needs a surgery. I think that's a good example, I think. Sometimes I give good examples also. Okay, like a patient really requires a surgery, and then you are going to deal with the paracetamol. Okay, that is a very simple example. When surgery is required, surgery should be provided. So the reason why many thousands of people are failing in OET reading and listening is this one. The reason is very simple. They are habitual to, they are addicted to answer sheets, answer keys and these simple things. There is no kind of improvement at all there. There will be no kind of improvement, and we have got this method. This is known as mention practice. We are going to do the mention practice right now. I don't have to give you any more introduction to this one. If anybody came for this class late, you can watch this completely. All right. So now what you have to do is read this one. Take your pencil, take your notebook, take your paper, and based on this paragraph, you have to say whether these statements are mentioned or not mentioned. So please don't misunderstand. I'm not saying true or false. It is not like a true or false. It is all about mentioned or not mentioned. Mentioned means according to this paragraph, is it mentioned? Not according to you, not according to you. You may think something differently. So we are not at all emphasizing on the personal opinions, EO, but we only want the writer's opinion and the researcher's opinion. Sometimes you can see some researchers here, professor something. Okay, so personal opinions are the biggest problems, but I'm not saying that you should never go for personal opinions. You should also go with the personal opinions when there are no other opinions. So all the best. If you have any question, ask me. Otherwise, you have 15 questions. Go through this page. Keep your phone in the landscape mode. Okay, keep the phone in the landscape mode. Make the screen bigger by zooming in, and you can start the work now. All the best. You have you have total 15 minutes to complete this task. Any question you can ask me now.
All questions, sir?
Yeah, there are 1 to 15 questions are here.
Okay.
Please.
Hello.
Yeah, please ask me.
Sir, sorry, sir. Sir, just now I joined. Sir, this is mention practice, sir?
Yeah, it is mention practice, yeah.
So we can write only and
you can write whatever is mentioned and whatever is, for example, look at the first one. TMT has multiple symptoms. According to your understanding, see what I have done is I have slightly or completely modified this some of the sentences or most of the sentences to confuse you. So we are just trying to see whether you are able to understand a certain sentence in multiple ways. So TMT has multiple symptoms. So according to you, this is mentioned or not? You can find that. Second one, less than half of those diagnosed with the least number of symptoms require treatment. Less than half. You should find the same in the original paragraph. Those diagnosed, okay, not treated, not suspected, but just diagnosed. There are multiple things here. With the least number of symptoms, what do you mean by least number? Suppose there are 10 symptoms for a particular condition, then the least number is, of course, number 1. Only one symptom. The least is 1, of course. And then TMT is curable. Curable or treatable? You have to understand. Everything that is treated is not cured. So, and as per the number method, is means it is 100% or 10 out of 10. At the same time, maybe is 5 out of 10. 5 out of 10. And sometimes can be is a little more than 5. It can be 6 to 10, 6 or 7 or 8 or 9, mostly 9. So you can apply the number method here. I'm sorry, my throat is not really good today. So it is here is. So you have to use your intelligence completely, and then you can write this one. All the best. Any other question, please ask me. Others, you can start the task. Others can start the task. Sorry. These are the 15 statements, and you have to say whether they are mentioned or not. All the existing members have to score at least 12 out of 15 to enter the A group. Those who have completed, please raise your hands. Please raise your hands up after completing this one. Those who have completed, please raise your hands. It is important to complete fast. You have 5 minutes remaining. You have 5 minutes more. You have 3 minutes remaining. Please complete fast. Yes, your time is just getting over, everybody. All right, your time is over. And before we start, we have a small question to do here. Sorry. Yes. Here is a very terrible question for you. Please complete the last question also. There is a question. According to paragraph 2, yeah, there are 4 options here. Please complete them. This is your last question. I think you are able to see this one, please. Those who have completed the question, please raise your hands. Now we can start. All right. Listen, I have a question to some of you. Anybody can answer this. When I gave you this question, this last question, was it very easy to answer this question? Did you find this easy to answer that question, the single question, the number 1?
Yes, sir.
Like when I gave you this
For
question.
me, it is easy, sir.
Okay, fine. Okay, when you did this question, did you really go back to the paragraph?
No need, sir. By understanding the paragraph, we can answer, sir. Already we have gone through fully.
I am coming to that. I am coming to that point only here. Everybody, please listen. There are 35 participants I can see here. And see, now I am sure. Please be silent, please, everybody. Lucy, it's from you, please. Okay. Now listen. See, when I asked you this question suddenly, many of you, I'm sure, many of you answered this very easily, even without going to the paragraph, this paragraph. I'm sure. I don't know how many of you did that way. I may be wrong, but still, generally, it was easy for you. Why was that very easy for you at that time? Okay, by the way, what is the answer for this one? This question. According to paragraph 2, buttocks will be in use for TMT in the future. Will be is saying very clearly. Will be is like, you know, it is 99% or 9.5 out of 10. This much high chance of high possibility is there for will be, but that is not the same as maybe. That's not same as can be. They're all different one. Or one more is there. Buttocks is in use for TMT in the future. Okay, so not for the future, at present. If it is at present, we can use is, that is equal to 10 out of 10. Okay, so that number is different one here. So the original one was will be. Will be means it is almost sure. So did anybody support this one? The number 1, please raise your hands. Those who supported the first one, please raise your hands. Your answer may be wrong, you may be right. It's okay, but you have to raise your hand if you had agreed with the A. I can see 3 of the members have agreed with this one. Tripti, Mithila, and Christy. Is it because you forgot to put your hands down, or you still believe A is the right one? Yeah, I can see Aditi also joins that. Buttocks will be in use for TMT in the future. Is that a personal opinion, please? Is that a personal opinion? Is it a personal opinion of yours, or is it based on the original text? Okay, let's see that. There are 3 participants. I think, Tripti, are you really going for A? I think you are not there, right? Or you forgot to put your hand down. Maybe you thought that this will take more time, so you left the place. Mithila, are you listening to me?
Yes, sir.
Okay, fine. Okay. So I can see that there are 2 people who have agreed with this one. Probably Tripti is not there. Okay. Going to the second one. How many of you support the second one? Please raise your hands. Botox is already used for TMT in some countries. Anybody supporting that? Okay, there is nobody supporting the second one, B. Nobody here. Okay. Botox can be developed as a potential drug to treat TMD. Is it mentioned or not? I mean, is it how many of you support this one? I can see that 8 out of 35 of you have agreed. No, the number is rising like anything. 17 out of 18 out of 19 out of, shall I wait? Some people are having some kind of osteoporosis or something. They cannot raise their hands very fast. See, actually, you don't have to raise your real hand. Just there is a button. Just press that one. Okay, there are 23 members. Very good. Seems to be correct one. I think I too agree with that one. I do agree with that one. But at the same time, there may be more intelligent people in the class. I'm not making fun of anybody, okay? It is real, okay? Because some of the answers which I earlier thought to be correct were incorrect. And is there anybody who is so bold to think that D is the correct one? Anybody here? D, supporters of D. Botox will have more harmful effects than any good when in use for TMD. Mentioned or not mentioned? Not according to you, but according to the paragraph. I think there are some supporters for that. Is it true? Sharu, Jayamol, Mahalashmi, Priya?
No, sir. I'm C.
Yeah, please put your hands down then. Okay, please
I
put your
have
hands.
chosen C, sir.
Okay, then those who don't believe this one, please put your hands down. Okay, Tripti, yeah, Tripti, you came back. Okay. Okay, so
Sorry, sir, my baby
None.
was crying, so I was away.
Okay, no problem. We were telling something about you, so you can listen to that in the video. Okay, we were saying something. Okay, so now listen. So correct answer is this one is a correct answer, and you know the reason for that. Now, there are only 2 or just 1 person. Okay, that means very clear. It's very clear to everybody that. But one thing, you know, only 24 out of 37, 35 people raised the hands. That means what? 24 people were sure and 10 people were not sure. This is a serious problem. Being unsure about something is really bad. You have to say something. Okay. So you have to be able to decide something. Now, it is important for you to look at the score of your mention practice. There are 1 to 15 questions. Now listen. These statements are all taken from the same paragraphs, but they are modified and they are disfigured sentences. Now you should have the ability to understand whether they are mentioned or not mentioned. So in the next 10 minutes, we are going to complete this one. The first one, please come to the first one, please, all of you. You can look at the first one now. Okay, now listen carefully. First one, TMD has multiple symptoms. Is it mentioned or not? Anybody can answer? Come on.
Sir,
Yeah.
indirectly mentioned.
Yes,
First one is
mentioned.
first is mentioned. Okay. Less than half of those diagnosed with the least number of symptoms require treatment.
Yes,
Not
sir, mentioned, sir.
Not mentioned.
Because less than of percentage means up to 33% of the population has had, and
Okay.
symptoms very less means 5 to 10%.
All right. Less
Sir,
than half of those. Yeah.
but you have just now explained, sir. Least means 1% only. That's why
Not
I
percent,
mark
not
is not
percent.
mentioned.
One. The least is not the percent. Least is just a number. Okay. When there are 10 symptoms for a particular condition, the least symptom means number 1. Only 1 symptom. That's not the percentage wise. That's number wise. Okay. I'll make it more clear to you. less than half of those diagnosed with the least number of symptoms require treatment. See, look at this one. Least number. How many symptoms are mentioned here? At least one symptom. Okay, now the least number is always this one is the least one. Required treatment is requiring treatment is also here. Less than half of those diagnosed. How many people are diagnosed here?
33%.
33%.
No. Are you sure they are diagnosed? They have
Sorry, sir, it
symptoms.
is symptom.
The population, that is 33%.
Okay, population is fine.
Population
If
10%.
a person is having a symptom, does it mean that it is diagnosed?
No, sir, because it's not clearly mentioned it is diagnosed. They have the symptom.
Symptoms only. Everybody who is having a symptom is not diagnosed. You have to go to the doctor, and the doctor will, based on the other symptoms or the other, okay, only then. So at least one TMT symptom. It is just a symptom only. For example, maybe migraine. I don't know whether it is migraine is one of the symptoms anyway. So symptom and diagnosed, there is a problem there. This is how OET is becoming very difficult for many people. Like we have to be microscopic in terms of our searching for the answers. Like you have to go so deep. So if you get tired of this kind of a class that you are getting right now, you will not be able to, I mean, your OET preparation will be very tough. But there are so many people who are passing OET with these kinds of methods, and you can really do that. Once again, look at this one. Up to 33 of the population has. Up to 33 of the population. Which country's population? There is no definite country mentioned here. It can be any countries, or the world population can be that. Up to 33 of the population has had at least one TMD symptom with 5 to 10% requiring treatment. Now the problem is everything was fine, but there is only one problem. You thought that a person who is having a symptom is diagnosed. Symptom is not diagnosed. I mean, it's okay. 50% we can say, we can agree with that answer, but we cannot agree with a 50% answer. A 50% correct answer is not usually a correct answer. Symptom and diagnosed. I have the symptom. I have some symptoms of COVID now. See, I'm having sore throat. It is a symptom of COVID. Does it mean that I'm having only COVID? No. See, this is my limited medical knowledge. Please, I may be wrong in some ways. So you can always think that I'm wrong. Okay. So that you will also have a very critical way of looking at the trainer. So if you believe the trainer completely, your brain will not work. You have to think, okay, he's going to make some mistakes today. I'm going to point out those mistakes, and I will publicly or privately, I will speak it out. No problem. You are welcome to that. Okay, so think that way. Make your mind more active, more critical, and very logical. So here, the problem is with the word diagnosed and symptoms. I think it has well cleared your confusion here. So the second one is supposed to be less than half of those diagnosed with the least number of symptoms require treatment. It was only to confuse you. The problem is with the symptoms and that one. Therefore, this is not mentioned.
Not mentioned.
Yeah. So no problem. See, there is a problem in this class. In this 12 p.m. class, there is a problem. When your score is going down, see, for example, there are 15 questions. Now, suppose whose example can I take? Christy. Okay, Christy is she is our example. Okay. But actually, it's not like that. Okay. Suppose Christy is going to get 0 in 1, 2, and 3, and she scored good in 4, and again 5 and 6 were wrong. So usually what happens, Christy or anybody else will feel negative. They will like to leave the class because it is really breaking their heart. No, that is totally escapism. That is completely running away from the reality. Stay here, understand your problems, argue with me, no problem, and understand. That is the most important one. Okay, we can move to the next one. GMT is curable.
Not mentioned.
Not mentioned, sir, because
Not
underlying
mentioned, sir.
mechanism of TMD often remains unclear.
Yeah.
Yes.
The reasons are unclear, okay, but we are talking not about the reasons. Underlying reason is not the question here. We are talking about whether it is curable or not.
if reason is not clear, they cannot treat properly, no, sir.
Oh, that's correct. That's correct. That's a good example. Yeah. If the reason is not clear, okay, you're right. Again, there is one more reason for you. Curable and treatable are different, right? Curable
Yes, sir.
and treatment.
No,
From that disease, but treatable, it's symptoms only treating.
Yeah. Somebody is trying to say something. Who is that? Mahalashmi, is it you?
yes, sir. There is a difference, sir. Curable and treatment is which we are giving reducing the symptoms, and curable means completely.
Yeah,
So it's
curable.
not like that.
Even if it is completely or partial cure, because there are these two terms are available in English. I mean, in medical scenario also use this one, partially curable and completely curable. Okay, but still treatable means you can treat. See, for example, a patient is having multiple, failure of multiple, organs, and he is in the 4th stage of cancer, and he is around 75 or 85 years old. Is it treatable?
Yeah, it's a treatable, but it is not curable.
Curable, okay.
For example, AIDS also we can take. It's not a curable, but
Yeah,
we can
curable.
treatable.
Okay. So there is a difference between, there is a difference between treatable and curable. So here, look at the third one. TMD is curable. TMD is curable means when you say TMD is curable, it can be 30% curable. It can be 90% curable. It can be 99% curable. Okay. So there is a difference in curable and treatable. You can treat anybody, but there is no guarantee that it will be cured. Curable. Okay, it's just like looking and seeing. See, do you think that everybody who looks will see? You are looking for something, right? You have lost your mobile phone and you're looking for that from the whole morning. You have been looking. Okay, and seeing is the next one. Looking simply means opening your eyelids. That is looking, and seeing is the effect of that one. Okay, so treating is the starting point and curing is the ending point. Therefore, TMD is curable, is not mentioned. See, again, I say all the questions of OET reading are going to be, they will be indirect questions are coming everywhere. Indirect questions are coming. I'm not scaring anybody to run away from OET. You can pass OET. There were so many thousands of people who were passing OET in the last 2-3 months. Okay, you can also pass, no problem, but you should understand this one. Okay, 1 second. Yes. Now, TMD is curable is also not mentioned here. In this case, it is not mentioned. Okay, TMD is a chronic condition. Is it a chronic condition?
Not mentioned,
No,
because
not
once
mentioned.
TMD is chronic. Once, if it is not always chronic.
TMD is a chronic condition. That means when I say Geetu and Jaymol are from Kerala, does it mean that Jasin is not from Kerala? She's also, but I'm talking only about Geetu and Jaymol. Or I'm saying Julie Thomas is drinking coffee right now. That doesn't mean that Anjima is not. She may be also, but I'm not talking about Anjima here. I'm talking only about Julie Thomas. So in this case, TMD is a chronic condition. Is it always a chronic condition?
No, it is not only
No,
Once it becomes chronic, okay. Once TMD becomes chronic, that means it can become chronic, right?
it can become, yes, sir. It is not always chronic.
So TMD is a chronic condition. So when I say TMD is always a chronic condition, now is this correct or incorrect? It is incorrect because all the time TMD cannot be chronic. It can become chronic, and once it becomes chronic, it will always remain chronic. That is not mentioned there. That's my personal opinion. All right, okay. TMD is, but there is a word always used here. But in the original one, which I gave you earlier, is a chronic condition. So now, is it now mentioned?
Is means always, sir, 100%.
Yeah,
but it is not 100%.
So if you write something like TMD may be, okay, or can become, These are all correct. And when you say
Correct,
is
sir.
a chronic condition, it is going to be creating a problem here. TMD is a chronic condition, even that is also not mentioned. Some of you don't agree with me completely, I know that. After a few days, you will have to agree with me completely, but agreement should come from freely from your mind. Only then your own logical thinking will be equal to mine, and after that it will become better than mine. You have to always think about becoming something always better than the trainer. That is very important for you. You have to become, okay, so just don't think that, okay, I'm able to get this much, so I'm happy, I'm able to think like the trainer, like Vibina ma'am or myself or any other trainers. That's not enough. Because if I go and write OET exam, I will fail 100%. Especially in listening, I will fail. Okay, so you have to become something. We are only showing you the way, and you have to go by the way, and you have to find it out. Okay, we are moving to the next one. Okay, if anybody has any kind of disagreement, you can talk to me privately, because this class is going to be exceeding the time now. Okay, so we have to complete fast. A chronic state of TMT reduces an individual's overall health quality. Is it mentioned or not mentioned?
Not mentioned, sir.
Mention, sir.
It is mentioned. A chronic state of TMD, yes, TMD is there. A chronic state is also there. Reduces is also there. An individual's overall health quality. Now, some of the words are not directly given, but they are a little bit indirectly given. I'll show you how they are mentioned there. Okay, 1 second, please. I will show you. Now here, first one, a chronic state. Let's see where the chronic state, once it becomes chronic, fine. It can be debilitating, ability and debility. That means it can reduce, okay, with comorbidities. When you have comorbidities, of course, the overall health quality also comes down. It can be debilitating with comorbidities such as teeth grinding. Okay, examples are also given here. So that is mentioned one. Okay, so try to understand that is a mentioned one. If you don't agree, you can tell me why you think it is not mentioned. A chronic state of TMT reduces an individual's overall health quality. So please, I tell you, do not look for the exact words or synonyms. Earlier, OET used to confuse you with the synonyms. What is synonyms? Words with the same meaning. Okay. And now OET is not even depending on synonyms. They have gone a higher level of confusing you, because synonyms, everybody understood synonyms. Now they are playing with indirect things. So to find out the indirect answers, you have to apply the main idea method.
Actually, there is mentioned comorbidities, and I thought it is not mentioned, sir.
No, comorbidity means when a person has got these conditions and comorbidities, indirectly we can say
I
that.
know, sir.
Yeah,
Yes.
oh, correct. Thank you. Okay, fine. Going to the next one. Irritable bowel syndrome is a symptom of TMT. Remember, I have used the word symptom. Is it a symptom?
Not mentioned.
Not mentioned, sir, because it's comorbidities.
Mentioned.
It is a comorbidity. Some of the comorbidities are symptoms also, but we cannot say this. In this case, it is not mentioned one, okay? Because when you have this problem, then you will also develop irritable bowel syndrome. Usually, symptoms happen first, only then the issue will be clear and diagnosed. So we cannot say that irritable bowel syndrome is a symptom. The problem is with the symptom. The word symptom is the problem here. Coming to the next one, 7th one, treating the underlying causes of TMT is always more rewarding than. Rewarding means, what's meaning rewarding? Beneficial. Okay, beneficial. I have used the word in a different way to confuse you than the other treatment options. Is it mentioned or not? Is more rewarding.
Not mentioned.
Clearly, it is not mentioned
mentioned,
anyway. Yeah. Because treating the underlying causes of TMT, you can look at this one, the multifaceted nature of, what is the meaning of multifaceted? Having multiple phases. Okay, nature of the disease means that the underlying mechanism of TMT often, what is the number of often? And if you do not know what's the number of often, I tell you, often is 8 or 9, often. Okay, often remains unclear. So it is unclear, and then if something is unclear, how can you give a treatment for that? And if you cannot give a treatment for that, then how can it be rewarding? And if it cannot be rewarding, then how can it be more rewarding than something else? all broken, all impossible. Are you getting my point, all of you? Are you
Yes, sir.
getting,
Yes,
or
sir.
are you
Yes, sir.
becoming
Yes, sir.
you're becoming angry with me because your scores are going down?
No.
Okay,
No,
so
sir.
our other trainers are also doing this kind of I mean a deeper level of analysis is being done by others. I think I have noticed Rose doing this one, and Anne is also going to do the same thing. Okay, fine. So you should never miss their classes because they are taking maybe 3 or 4 hours of training for just one hour of class. So you should never miss them. In case you have to miss, no problem, miss it, but don't miss the videos. It's very important. So out of these 7 questions, how many of you got at least 6 out of 7? Please, will you raise your hands? 6 out of 7, a minimum of 6 out of 7. Great. Great. That means you are close to booking your examination, and we have to wind up this session. Okay, we are going to wind up this session and we will be discussing. Yes, tell me.
Will you please tell me the exact meaning of symptom and comorbidities?
Okay,
Sir?
the best thing is you can just go
Comorbidities
to,
and symptoms.
the best thing is you can go to Google and you can just search for symptoms versus comorbidities. Like,
Okay.
see, you're having a problem like TMD, you're having TMD. Okay, and when you have a particular disease condition, so many other disease conditions will also develop, and that means comorbidities. Co means what is meaning? Cooperative, cooperate. It means something like adding. Okay, comorbidities are all kinds of disease conditions that come together. Okay, so that is the comorbidities. Symptoms, slightly they are different. Like symptoms usually appear before the comorbidities and the morbidity develop. First,
Okay,
symptoms. Okay, symptoms are you know very well. Okay, symptoms just to show that there is an underlying problem there, and because of that you find it out. Okay, so comorbidities. So comorbidities may develop after some time, or it may be already there, and you can diagnose it. Maybe after diagnosis you will find it out. Maybe before diagnosis also it was there. And somewhere I noticed in Google that symptoms, some of the comorbidities are the symptoms of other conditions. See, there is a connection there. So in a way, we can say that the condition, the comorbidities, and symptoms, they can be interchangeable. But basically, in that answer, we have to understand that way only. Okay. So, yeah, good, no problem. So those who did not get a good score this time, no problem. You're going to have the discussion of these in the during the 6 p.m. class. These will be discussed during this one. And with that, I'm going to wind up this session. I think it was really beneficial for you, but I'm sure it was very, very boring for you. You did not really like this class. I
No,
know
sir.
that.
No.
No,
Okay.
sir, this
No,
is
it is
very
not boring.
interesting class.
Okay, then it's okay. Then I'm thankful to you. Okay, fine. So see you then. The next class will be at 6 p.m. Never miss the classes. Very important. Okay. So then see you then. Bye-bye.
Thank you, sir.
All right.
Thank you,
Thank you.
sir.
Okay. Okay.
Thank you,
Bye-bye.
sir.
Okay.